Assalamualaikum guys, this is Dr. Hasna back to make your life easier with medical or career pathways. I'm your man. So keep watching till the end. Today I'm talking about a very key question that keeps coming up. Many people bring this up, and that is, I'm sure you guessed it from the title, it's what is the difference between PLAB and USMLE. So I decided aaj bata hi dete hain. Let's just finally tell you guys and try to use English now just so that everyone can hear it. Okay, so I'm going to tell you what is my personal opinion on these two. There's no such thing as, I haven't researched this or anything, but in my view, this is my perspective that I'm going to share with you. If anything is wrong, please don't bash me for it, because I'm just telling you what I've seen from my experience, from people that have been around me. So firstly, the more you invest in something, the more that will come back to you, right? Keep that in mind. Therefore, the major difference between PLAB and USMLE is how much you invest and how much you get back. And in the case of PLAB, you can say it's a laborer, like a middle class family. You give enough and then you get enough, okay? Whereas USMLE is more like the elite class, you invest a lot and eventually it does give you a lot, maybe even make you a millionaire. So that is the key difference. This is the first thing I wanted to say to make sure that you know the difference between them. It's like one is a middle class, one is an elite class. I'm sure many differences you've guessed from there on. Okay, now let me explain to you what I see, what do I see in my view, and what should you choose. So let me also help you make a decision, right? So obviously there are many other pathways and people obviously want to know about Australia as well, but these are the most, let's say, talked about. I'm talking about them, right? So firstly, see, in PLAB, you don't invest that much, okay? In you can say 2,000 or 3,000 pounds, I believe it's possible to have your PLAB done. In USMLE, it goes to thousands and thousands of dollars that you have to invest in that, pathway. Only then you get something out of it. The PLAB is the UK exam. It consists of part 1 and part 2. Part 1 is a written exam, whereas the part 2 is an OSPE exam where you talk to the patient. It's basically consultation based. Once you pass the PLAB 1, the PLAB 2, you enter the UK as a junior doctor. So this is a very important key difference. You enter as a junior doctor, which is basically just like a medical officer or a house officer or just an HO, FY2, FY1 officer in the UK. You're not a specialty person or specialist. You're just a random person that's go get the tea. No, not like that. But in doctor terms, you are that person that gets tea for everyone. Not really. But I believe junior doctors, major respect for them. That's how you're treated basically. It's the most junior level of being a doctor. Let's talk about the USMLE. USMLE, now that, although it's a lot of investment, it's 3-part exam for the USA, a more difficult exam compared to PLAB 1, because obviously you're going to become a specialist out of this, a resident out of this. Let me explain it to you. USMLE step 1 is more about your basic subjects like first year, second year, third year, basically pharma, anatomy, and patho, all those subjects that you guys basically ignored all your life. Those subjects are the major constituents of the USMLE part 1, and that's why they say for USMLE usually give the exam while you're in medical college so that you have the fresh knowledge of these or fresh memory of these subjects. Part 2 is more clinical based, more like the PLAB 1 exam, but obviously a lot more deeper than that, a lot, it'll pry your brain a little bit. And finally, step 3, I believe it's some OSPE exam. Not sure about the step 3, but that you can give on later, right? In the case of USMLE, after part 1 and part 2, yes, you can go to the USA, but you have to apply for a match. You don't need the step 3 to work there. After step 1 and step 2, you've passed, you've applied for a match, and you apply to many hospitals, and you might get just 5 matches out of 200, 300 hospitals. And even for each match, you will be paying a certain amount of dollars. So just imagine how expensive that is. And once you get matched, you will enter their system as a resident. No longer are you a non-training or a house officer. You will be entering as a training doctor or a resident. I hope that makes sense, like PG trainee. Does that make sense? So that's why USMLE is a little more difficult exam than the PLAB exam. So PLAB is just testing your basics. In the PLAB part 1, they're testing your clinical subjects, just the basics. How much do you know as a junior doctor? And then PLAB 2, similar, just consultations this time. Once again, they're just testing your basics. With a USMLE, they're seeing how deeply you can grasp all the concepts, how crazy stuff, just because obviously they're not going to let you become a trainee in their country for no reason, right? They're going to give you something. Let's talk about the differences in the countries, okay? Now that you've decided, I'm sure by now you should have decided that do you want to invest a lot? Do you have enough money? Do you have enough funds? So once you've decided that, next comes the difference between the two countries, okay? UK and USA are completely different. One is Europe, one is, America. And you all know America is known to be the OG country, right? My personal preference is definitely UK. That's the reason I am going to pursue a pathway in the UK. But at the end of the day, it's everyone's personal preferences. So let me talk about the differences in the country, okay? Obviously, another thing that will help you impact your decision would be the difference of the country. Where would you want to live, in the future? Would you like enjoy the USA? Would you enjoy UK? So the biggest difference lies in the fact that UK is a very historic place. It's like tiny, tiny, tiny. Things are very close to each other. So mostly even public transport is used, and like trains, trams, buses, taxis, not taxis actually. It's like trains, all public transport. That's all I can recall right now. Those are mostly used. You don't really need a car. Mostly you walk to places. Everything is super close by. Everything is super beautiful, and like the weather remains gloomy is what people say. But if you like rainy weather, then weather is always like a rainy. The sun, you hardly see the sun. Like you can totally say goodbye to sun when you go to the UK, right? So that is the UK, and all over the year the weather in the UK remains moderate, which I think that's amazing. Is that it never gets that hot, it never gets too cold. Whereas let's go to the USA. It's more spacious, it's more open, things are far away. Walking is not the way to commute, but like it's more, you have to be on cars. USA, it's like it depends on the state. Some states get too super cold, like with -20 degree, with snow, ice, all of that. And mostly in USA you will see the sun, which you probably won't see in the UK. There's one more thing. So guys, basically these are the major differences between the two countries. For me, it was more about, UK has, I like the way UK looks, and really my decision was based upon when I came in 2011, when I entered UK for the first time, I knew this is where I want to be. I've been to other countries, but UK just had my heart. So that's how I knew I wanted UK. I also knew that I might not have the best financial situation to be able to do the USMLE. I also knew that I have a lot of family members living in the UK that can even help me. Your decision should be based upon your situation. So this is Dr. Hasna Star advice. I want you to keep in mind that whenever you're deciding, think about your situation, okay? And a lot of people even ask me why I choose this, why didn't I choose that, why didn't I? They don't ask me why I chose this. They ask me why didn't I choose that. So people are going to come, they're going to detract you, they're going to, question you. But once you've made a decision, you have to promise me, you have to stick to it. And don't regret your decisions, your choices, okay? One more thing is that, let's talk about the outcome. UK is a little bit saturated at the moment, but I'm not going to underestimate USA. Obviously, USA is also saturated. In both cases, there is going to be difficulty to find a job, a match in case of US, but a job in case of PLAB pathway. But honey, I just want you to know, every pathway is going to require hard work, and wherever you are at the moment, you probably think this is the toughest. That's an issue that people have, and mostly wherever you are going to be, people are going to be discouraging you about that pathway. But I don't want you to take that to the heart. Another difference is that in PLAB you usually become the non-training doctor, whereas in USA, let me tell you what happens is you go through 3 years of training where you're a resident. You don't really earn that much while you're the residency years. It's after the residency, when you become the attending or the consultant, is when it starts giving you what you actually invested into it. So you actually start earning as a consultant. And another view of one of my peers who told me, in the USA, why are you thinking that gets you a lot of money? That person was of the view that you invest so much that when you get the money, you're just paying off your loans. So it's really equal. So I don't know, that's another view of someone, but I believe you earn a lot, but yes, obviously loans. But always remember, even the specialty also matters a lot in the USA. So if you're a neurologist, you earn a lot. Like you earn, like there's demand of that field. But as another, like just a family medicine, maybe you don't earn that much, but obviously you earn a lot. So that's also, there's a difference in the specialties as well. But that's something you explore when you want to do the USA. So guys, these were the major differences. You decide according to yourself. If it's not the UK or the USA, then you can decide if you want to go to Saudi Arabia, to Dubai, to Australia. That's also up to you. But for now, the PLAB USMLE debate should be over, because many people ask me this question. I hope I've answered your question. If any other pathway you want me to compare, anything else you want to ask me about the career thing, comment down below. But for now, star advice of Dr. Hasna: make a decision, stick to it, don't listen to anyone, decide according to your situation. Thank you so much for watching.